Okay, so today I'm gonna teach you all how to put a bandage for this feeding tube when you have your kitty cat being fed through a feeding tube. So the first thing we have in here is a bed wrap. We make it nice and loose before we're going to place it for the bandage on top of that tube. So we just making it all loose so that way when we're bandaging the tube doesn't become so tight on their neck, because we don't want the bandage to be tight. So this is the first thing that you do. Now we're gonna clean that skin just to make sure that there's no any kind of goo in there, any kind of chunks, but that's normal to find them, but it's good to take them off every time that you do a bandage change. You need just to have a clean, nice looking skin and then place the new bandage. So I'm just grabbing just a sterile saline with some gas. I'm just gonna clean it with this, and then we start our bandage process. So she had here before a little central line placed in, and now this is the tissue that is healing and has a little scar, so we're just taking the chunks off until she gets a nice clean skin. We don't have to be very strong at doing it, so that way we don't make the skin all red either. Just a little gentle swiping this. And now I'm going to show you by the side of her feeding tube. I know, baby. So in here she has little chunks. This is normal, they always get kind of these little chunks in there, but we clean around the tube very gentle. We always hold the tube and we always just clean it, trying to remove all those things very gentle, so that way the skin is free of that at the time that we place the new bandage. You just go very carefully around the tube and looking in between those sutures to make sure that there's no any kind of little goo, or you look for the skin that needs to be just the normal color, nice and pink. You want to make sure that there's no pus either, or kind of swelling in the area or redness. It has to be looking nice and pink, and the regular color skin that you see everywhere else on her neck that has been shaved previously when they first placed this feeding tube on her. So now I'm just gonna dry the skin. The tube, do not worry about the tube ever. You need to feel comfortable touching this area, because the tube is there and it's safely really held in place by these sutures, so it will never come out if you just clean it with care. Doesn't really hurt the cat if you're going to clean this with the little gauze, just by these gentle movements. It doesn't hurt her, doesn't bother her. And then now it's dry and she's ready to have her bandage placed. I always like to use a little, any kind of Neosporin, or those this one for example is called polysporin, but any kind of antibiotic that you can put topically here around the tube, so that way it maintains the skin protected from infections. So just place it around, and then she's good to go. We're gonna put this little piece of telfapad. This is something that avoids that the bandage gets all stick together within the skin and bandages. So then I place this as nice gel pad. That way we don't have the next time that we get to change this bandage, anything stick to the bandage. So that way it's easy to remove next time. So then I just make a little opening in there so that way it holds the tube within, and then the next thing we do is this cast padding to help holding that tube in place. We're gonna start rolling this under her neck. You can use both hands. It doesn't have to be tight in there, but enough that it's not too loose, so that way the tube won't fall down after she maybe does a little shake or something. To be nice and loose, but not too loose, not too tight. You have to be able, when you finish, to place 2 fingers in there with this, so that way you can peek through the bandage and look on the incision and see how it looks, just to make sure that everything looks nice and clean before the next bandage change. It usually can be done every 8 days, every week. I know, little girl, almost done, boo-boo. She's learning as well how to hold this thing in. She's not really used to the bandage change, so she wants to go. Every single kitty cat doesn't really like to be held for that long for anything. But this is it. You can even put a little bit of tape in here to just hold this, or you just can leave it there and just use the bed wrap. Right here, I'm just gonna make this little trick that makes it easy for you to start wrapping it around it. So I'm just gonna do that. You stick it together. This is the advantage of the bed wrap. The bed wrap really is so easy to use because it sticks together and doesn't have a glue, so it doesn't stick to your cat's skin. It really doesn't bother them, and then you can also remove it so easy every time you need to do the bandage change. And now I'm just gonna cut it. I'm just gonna leave some more space. Now I'm just gonna open a little hole to put the tube through it, so that way the tube gets a little more stability in there.
That's so beautiful.
It's just a little trick, so that way the tube
It's the
stays
little
with
tricks that make a difference.
So that way it's easy for her to have it in place, and then the tube is securely held in place. So leave that here, little baby. There. Then what I usually like to do is always to use just the regular tape with them, the white tape, how you call it, so that way we have it secure even better, because when they shake the head, this thing can sometimes bother them when they want to shake their head. Then they have something in there that is banging to just one side or the other. So I use little tape. I'm going to show you how to put that tape, so that way it gives them some kind of security for them not to feel that thing hanging in there. I'm just going to go get the tape really quick. This kind of white tape. So the tube doesn't have much length to just make a loop in here, a big loop. So I'm just gonna leave
so
it.
that I can crimp it when I'm giving her the food through it, so that no air gets in there.
Exactly, so you can
crimp it like
just
that.
exactly.
Mm-hmm.
So I'm just gonna secure it at the very base. That way the tube is secured there. And then I was thinking if I could make it not to be so loose, so that way whenever she shakes, you can revise it, but then you would like to have it some kind of more.
Yeah, I need to be able to crimp it easily in between giving the flush and the food.
Exactly, some kind of more like motion in here, so
That's
that way you
great.
can have it.
Just like that is perfect.
Perfect.
See, if it's wrapped like this, then you don't really need to change it more than 1 week.
Yeah, no, you just need to pick through it, so the bandage is not too tight. You can revise how everything looks. You just can just gently lift it, and you can check on your skin, make sure that everything is looking fine in there, and then she's good to go. But see, it's not so tight that you can really put 2 fingers in there, and the cat is not choking, and you're not really bothering the cat just by checking just a little bit, sneaking, just lifting this thing. The bandage can be left in there for a good week, and you can check every day if you feel like it, or you can just do it as you feel every other day, just to make sure that everything looks good. But at the beginning, every owner is curious about how that should be kept and how that should be revised every day. So if you want to do it at the beginning every day, it's fine. And so every day that you do it, you will become more comfortable by just practicing like everything. So thank you, little girl. We're all done.
Thank you.